Hi, Logan County. I'm Dr. Boyd Hoddinott, your health commissioner. We thought we'd try to give you a few series of videos just to explain some things that are going on and answer some questions that we keep getting.
So what are the symptoms of COVID-19?
Symptoms of COVID-19 are somewhat like influenza or the flu. However, a lot of people start with inability to smell, inability to taste, and then often followed by a high fever, sweats, often a dry cough, and then it may go on to shortness of breath.
And what should I do if I have these symptoms?
If you have those symptoms, you should stay home and call your doctor. And the physicians really don't want those people in their office. We don't want them in the ER. And remember, there is no specific treatment at this time for COVID-19. But we want to know that you're not feeling well. And so talk to your doctor's office.
What should I do if I have severe symptoms like shortness of breath?
If you've got shortness of breath, you treat it like any other illness. That is, if you're not doing well, you're short of breath, you're sick, then you should go to the emergency department to be assessed. Of course, call before, but they have the facilities there to test you, the rooms to be safe so that these healthcare providers don't get it from you.
My employer is requiring me to get a test before returning to work. How do I get a doctor's note for the test and to return to work if I can't go to my doctor's office?
Right, well, you really can't get the test. We're really short of testing supplies, and right now we're limited to people who have symptoms and that we need to follow. But and we've asked employers not to ask for a letter when you're ill, but you'd have to talk to your doctor's office about that. We at the health department are not giving out letters to everybody who's quarantined, isolated, or has symptoms.
My husband's coworker's wife tested positive for COVID-19. Does my household need to self-quarantine?
No, only the person who are in closest contact to the isolated case. First of all, this does require somewhat close contact for a certain length of time, and we do not isolate the contacts of the contacts of the contacts.
My son came home from a Florida vacation on an airplane. Does he need to self-quarantine even though he did not leave the United States?
Yes, he does. In fact, I issued a request last week that anybody even driven from New York should self-quarantine for 14 days. And we have hot spots, although New York has almost half the cases in the U.S. New Orleans is a really hot spot, and so as Detroit, Los Angeles, and Chicago, and who knows where the next will come from. So basically, this is a stay-home order. This is even stronger for people who've traveled.
And what is the most important thing we as citizens can do right now to help society?
Thank you for asking that question. Stay home if you're sick. That's the one problem we've been having. I think people are listening. We see everybody washing their hands, trying to not go down an aisle at Kroger's if there's people there, so they're trying to self-distance themselves. They're trying to cover their coughs, and so the kids were well trained to do that, but we're having too many people go out when they've got symptoms of that they're being ill, and there's just no need to right now. And besides which, then you could give it to friends, relatives, or others around you.
Wonderful. Thank you so much, Doc.
Thank you.